and welcome once again to the Nature Series. On this week's program, and by the way, this week's program will be the last program we'll be doing for probably about another 3 or 4 weeks. We're going to take a break in. First of all, I'm getting married next week, so I have to take off for that. But besides that, we're going to take some time to regroup and put some new shows together. Some of the things that we're going to be doing is, a lot of you may know, the owls are coming back into nesting this year. The hawks will be right after that. The Canada geese and the ducks are mating and going to have young. So we're going to take some time to bring get all these shows together. And unfortunately, if we come back to you every week and try to get a show for that, we're not going to be able to give you the quality that we'd like to. So we'll be showing you reruns after this show for probably another 3 or 4 weeks, and then we'll come back to you with brand new shows. And again, they'll be a lot better than the other ones. The other ones were fine, but these are going to be a lot better. We're changing a lot of things, things that you people out there have asked us to do. So anyhow, on this week's show, we are going to talk a little bit about first aid. And with us is Ken Fobb from the American Red Cross. He's a volunteer, and he's going to tell us a little bit about some basic first aid tips for when we're out hiking and backpacking and doing those types of things. So Ken, welcome to the Nature Series, and if you could just give us a little background of what you do with the Red Cross and how long you've been with them and such.
Well, I've been a volunteer with the Pittsburgh-Allegheny County chapter for about 23 years now, and I'm the volunteer chairman of their first aid stations that cover the different community functions throughout Allegheny County. We also have a first aid safety team, which we train, and they work with me on the stations, and they're from the age of 15 to 18.
I see.
So, and we also respond in disasters when needed. And
I see. Very
everything
good.
Red Cross does, basically, I'm involved in.
Oh, great. So you have a good bit of experience in these, and a lot of different things, and again, with what we're going to talk about today. Again, our viewers are a wide range of, have a wide range of interests. They range from a lot of the basics of just basic hiking and backpacking and camping, all the way to rock climbing and things like that. But what we'd like to tell them today, and this is going to be geared more for the novice that we have out there, okay, or the occasional outdoor enthusiast. So we want to give them some tips on first aid, whether it be from a minor cut or a minor abrasion up into broken bones and maybe a head injury or whatever, so that they have an idea when they're out hiking for the day or camping or backpacking for a few days, what they can do until they can get some help. So I guess first of all, we can just start with minor cuts and abrasions. I mean, if somebody's out there and they're hiking up a trail, or they slide down the trail and they cut open, get a nasty cut, or they get an abrasion, just some of the things they can do there.
Well, the first thing in first aid is prevention.
Okay.
Know where you're going, the territory that you're in, the proper clothing, the proper boots, know how to handle any equipment that you're taking with you, and you can prevent needing first aid. But if something should happen, such as, say, a rock does slip out from under your foot, you lose your balance and fall down a hillside, and you put a nice gash in your leg.
Right.
Well, what you can do is, if you have your canteen with you, sort of wash out the dirt and that's in it.
Okay.
Stay seated, be calm. Now, you're going to have to think what to do first because of the shock of that fall.
Okay.
So once you get your thoughts going, then you figure, okay, now we clean the wound. Take a small first aid kit everybody should carry when they're in the woods.
Right.
And the size of that first aid kit depends on how long you're going to be away or what you're capable of using in it.
Okay.
And we can get into that later if you wish. Then take some gauze out of your first aid kit, place it over the wound, and just bandage it.
Okay.
Then check yourself over mentally, as well as feeling your leg physically, to see if maybe you did break a bone. And if everything feels fine and you attempt to arise and you have no pain other than the cut itself, then head back to your automobile at a slow pace and on to the hospital from there if need be.
Okay, so the main things that we want to concern ourselves with here, besides just treating the wound itself, is to keep ourselves calm. That seems to be, I guess, a major problem, that people get excited and worked up, which actually would make things worse, I guess. And then the other thing is to keep in mind is, once you do take care of the wound, clean it and bandage it and whatever, is the key there is to go back to your automobile or wherever and go slowly, okay? And that is what, mainly just to keep the blood pumping slower, or so that it doesn't go, or to keep you?
Well, it's to keep you from being under any additional stress and tension, because that accident that you had, every one of us, irregardless of the accident, whether we cut our finger at home in the kitchen sink, or whether we fall down a flight of stairs, we have a small amount of shock that does set in.
Right.
And by remaining calm, you can help fight, basically, this shock.
Okay.
If not, increasing your pain, the cold weather, rough handling, will all increase your potentials for going into shock.
Yeah. Okay.
And then you may pass out, and there you are laying at the foot of the hill, waiting for somebody else to come along.
Right. Okay. Another thing that I think we should stress is it's always a good idea, if you're going hiking or backpacking, if at all possible, to take someone else with you, of course.
Oh, yes. You should never go alone.
Okay. Now, again, we're out backpacking and a rock slips out from underneath the foot, or we lose a grasp on something and fall. And we injure, say we come up with head injury. Okay. Now, again, we should have someone with us. If we're by ourselves, what would we do in that situation?
Depends on the severity of that head injury. If you're knocked unconscious, you're at the help of whatever the elements are and whoever comes along. If you're not knocked unconscious and you seem to be dazed, and when you come around, again, calmly assess your situation. And if you can, put a bandage if you are bleeding. And just remember that all facial injuries and head injuries bleed profusely.
Okay.
You think that the wound is a lot worse than what it is. And it's due to the heavy vascular feeding of the tissues in the face.
Okay.
So once you are alert, you bandage yourself, again the same as if you cut your knee. Just calmly arise, try to head back to your car, seek help. If you feel dizzy in any way, or you feel like you have double vision or blurring vision, I recommend, if you do make it to the car, do not drive.
Right.
You can use the horn on the car for signaling. You can use your lights in the evening if it's on the roadside to flag down another car, and so on. But don't drive if in any way you feel that your mental capacity isn't what it should be. Right,
or unless we're out somewhere in the wilderness and we have to drive at least to an occupied road. But if we have to drive just no farther than we absolutely have to.
Right, yes.
Now, if we're out backpacking or hiking with another person or persons, and one of the people in the party falls and gets a serious head injury, okay, or if they fall and bounce quite a bit. A lot of times when you fall, especially down a talus type or a rocky type slope, you can't stop quickly. You continue down the hillside until you hit a rock or stop or whatever. And a lot of times there may not be visible injuries, such as, there may be abrasions or whatever, but, and maybe not even a cut or just a scrape on the head, but there could be other injuries, such, internal injuries with either in the abdominal area or the head. What can the people who are with this person, what should they do when this happens? I guess instinctively some people would run down and, are you all right, and try to help them up. Right. Okay, now what should they do though?
Okay, your buddy, after you've made this fall, should come down, and if you fall down what you just described, no doubt you're going to be unconscious at the foot. And when your buddy arrives there, he should just ascertain if you're breathing and if you have a pulse beat. Well, if you're breathing, naturally the heart's going to be beating. So once he gets that, then just put you in a comfortable position and keep you warm by taking his jacket off, or if you're out for a couple days and you got a backpack on, the sleeping bag, pull it out and cover the individual. And what you're trying to do is maintain body warmth to help prevent shock from being any worse than what it is. As far as internal injuries, the sad thing is there isn't much an individual can do there without the proper equipment and the knowledge, such as a doctor. So once the person is made comfortable and warm, if you have two buddies, the ideal thing is to send one back to bring help.
Okay.
If you do not, and you only have the one buddy, if this person will make this injured victim comfortable, warm, in a shaded area, if the sun comes up before he's able to get back with help,
Right.
then mark the area. If he knows where he's at, fine. If not, then mark a trail from where the person is injured,
Okay.
back to the road, get help, and then come back. It's a chance you have to take.
Right.
Unless it's somebody like myself who's rather big and yourself that's rather small, I might attempt to carry you, but
Okay.
I could cause additional internal
Right,
injuries by
right.
doing this
Okay.
because I don't know for sure if you have any or not.
Right. Okay. Now, another scenario here. We're just going to load you up with scenarios
Sure.
today and keep hitting you. Again, a person falls, breaks, whether it be a leg or breaks an arm. Okay. Now, when they go out, even figuring they're just going to go out for a day hike, so they take some first aid equipment with them. But it consists really of Band-Aids and bandages and first aid cream and things like this. And here they end up breaking an arm or they break a leg or whatever. They don't have splints or first aid type splints with them. What would they do, or how could they go about now? We can take substantial twigs or tree branches and put
Right.
those on. Give us an idea just how to prepare the leg or the broken bone so that we can transport them back.
If you fall and fracture a leg, you will know it because actually you can feel this bone snap.
Yeah.
You feel the tenderness and the swelling in the area. There may be some discoloration. What you can do here is, instead of attempting to walk on it to make sure whether it's fractured or not, treat it as if it is a fracture.
Right.
Get some limbs. And there's trees that have limbs that have fallen off during windstorms and so on laying around. You can always drag yourself to a limb and so on, because your leg is going to be in this straight area, let's say straight line,
Right.
and let's hope it's not angulated.
Yeah.
And drag yourself over, then place these tree limbs along the side of your leg. You
Right.
can use your belt, you can pull your t-shirt off, tear it up into small like swats and tie the tree limbs on that way.
Okay.
If you are still by yourself, once you get your legs secure, and once you have rested to the point that now I know what I'm going to do, I've thought it through, now slowly drag yourself down the trail that you were walking on, trying to avoid the rocks and any roots and so on that may snag on your splint.
Right.
And you can literally drag yourself out of the woods. I recommend, if you're going to do that, to at least take another piece of material from you, like on your shirt, and tear these shirt tails off. Wrap them around your hands if you don't have gloves.
Right.
This way, when you're pulling yourself along the trail, you can prevent cutting your
That's
hands.
a great
and that
idea,
up.
right? What about if it is, you mentioned there, hoping that the leg is straight, not angular. What if it is an angular break or a compound fracture where it has punctured the skin, just the basics there, I guess?
Well, if you have a small angulation and the skin has been punctured, you have now what is known as an open fracture or a compound fracture, was its old term. You have to treat that open wound as if it was an open wound with bandaging and dressing it.
Okay.
Then put your splints on. We always teach in our first aid classes to splint the angulation as it is. Try not to straighten it.
Right.
Because when you do, you have a chance to pinch any of the arteries or veins that run along the long bones, as well, which could compromise the circulation to that part. Or you could also cause some damage to the nerve structure
Okay.
and thereby lose the feeling in the leg altogether.
Okay.
So you have to splint the angulation like it is.
Okay.
With that, then all you can do is hope and pray that somebody comes along the trail,
Right.
or attempt again to drag yourself out, but you're going to have to watch the angulation of your leg.
Right. Okay. What happens now? You always see in the movies and you hear different things when people talk about first aids about using a tourniquet. When you're bleeding, considerably, and to stop the bleeding. Now, you know, a tourniquet is fine to use to stop it, but there are also hazards with using a tourniquet.
Oh, yes.
Okay, could you just tell us a little bit about those?
Sure. The best way to stop bleeding is elevation and direct pressure to the
Okay.
bleeding area. If this doesn't work, then you progress with not only the elevation and direct pressure, but you also slide your hand down and find a pressure point
Okay.
that is supplying, the pressure point's on the supplying artery to that bleeding
Right.
site. So you apply pressure to this pressure point. If that fails, and nothing has worked so far to control bleeding, then you must use a tourniquet.
Okay.
And when you decide to put a tourniquet on, you have to make a decision, life or limb.
Okay.
Because there's a possibility once the tourniquet is applied, and depending on the length of time that has passed, the person can lose the limb due
Right.
to because you're shutting off the entire blood flow
Right.
to that part of the extremity. Once the tourniquet is applied, it is never released.
Okay.
And if you are with a buddy and you have applied this tourniquet to your victim, you should take some sort of marking instrument and write across the forehead or on a tag if you have one, or a piece of adhesive tape and put it across the forehead on what time the tourniquet was applied.
Okay.
So that whenever medical personnel arrive and take the victim off your hands, you may not be able to go with them to the hospital.
Right.
But the medical personnel, as well as the emergency room personnel, can see, oh, the tourniquet was applied at 8:45 a.m.
Okay.
So they know what period of time has elapsed
Right.
since there has been circulation in the lower part of the extremity.
Now, when they apply a tourniquet, should they apply the tourniquet to stop the entire blood flow, or would it be sufficient to, safer to apply the tourniquet to the point where it just slowed down the blood flow? Would that be actually a better thing to do, or?
As far as the tourniquet, again, once you apply it, you made a decision, life or limb.
Okay.
A tourniquet's objective is to stop the bleeding.
Okay.
And if you put it on just, shall we say, tight enough to stop the gushing, but loose enough to keep it oozing, the person is still going to bleed to death by the time you get to the hospital, depending
Okay.
on the amount of time
Right.
that's going to elapse
Right.
when you arrive.
I see. Okay. Very good. Now, one of the, probably the most serious injury, or one of the most serious injuries that one can sustain in a fall or in an accident anywhere, but again with backpacking and hiking, is a broken neck. Okay, and it does happen. Now, if you could tell the people, just basically, if you're with a person, they fall, and you feel that they do have a broken neck, and the broken neck doesn't mean that they're dead, doesn't mean that they're going to die, whatever. A lot of times people are under the misconception, if you break your neck, you die, and that's it. If a person does fall, you feel that they have broken their neck, again, you're not sure, but it appears as though they did, so you just assume that they did. It's the better thing to do. What should they do to secure that person till help comes?
Okay, going back to the same story that you related at the beginning of the program, the person that fell down that long cliffside.
Right.
Anytime you sustain a head injury, you automatically assume that a person has a neck injury also.
Okay.
So you should immobilize the neck and the head whenever you're taking care of the person. So that means you've got to be careful how you move them, how you roll them, how you check the head for any injuries to the back. If they happen to be laying on their back, you want to check the back of the head to see if there's any injuries there, if they're bleeding.
Right.
So the only thing you can do without really moving the head is slide your hand under a little to see if you can feel some blood.
Right.
But the head and the neck should be immobilized on any head injury.
Okay.
And you can take a blanket. If you don't have a blanket, and the smart hiker in the woods wears several layers of clothing because he doesn't know the type of weather he's going to be running into, he could take one of these layers off, roll it, and make an arch over the head, and by using the belt, tie, handkerchief, and so on, can tie this arch down across the forehead and across the neck, which may help immobilize.
Okay.
Also, while you're in the woods, you can come across and pick up some rocks, which you can lay along the head like sandbags are used in a hospital.
Yeah.
And you can lay these along, and this will keep the person from moving his head from side to side.
Okay.
Because once a person's conscious, curiosity, and everyone does it, when you hear a noise, you turn your head towards the noise.
Right.
Well, you don't want to take a chance here with the possible neck injury, so by putting these rocks on each side, he cannot move his head towards the noise, and thereby, possibly if there is a fracture, completing the fracture and either becoming a quadriplegic or dying.
Right. Okay, now we've covered pretty much the basics of what can happen out there. And again, I want to mention to you folks out there that, again, on a 30-minute segment like we do here, we really can't go into a lot of detail on these. We're trying to give you the basics here. So, please, if there's something that we didn't cover, it's not because you're not supposed to do it or because we don't know about it. It's just that on the time element, we're really running short. So, speaking of time and running out of it, I have a few more questions here. Again, we've covered the different types of injuries and how to treat them as far as cuts and abrasions and breaking of bones and head injuries and whatnot. But I think the one of the most serious problems, I guess, outside of breaking bones and whatnot, is the administering of CPR. And a lot of people know CPR, but a lot of people don't. And of course, there's probably not a day that goes by that you don't see CPR in some form on TV, in some show, people doing it. So it all looks basic. You just pound on someone's chest and you press it, and then you breathe into their mouth and this and that. But there are specifics to CPR, to administering CPR, and if a person doesn't know how to do it properly, they can actually cause more harm to the victim than to help them at all. So if you could just give us a little bit of what not to do and basically what can happen to a person if you administer CPR wrong.
If you have never been exposed to learning the skills of CPR, I recommend don't do it.
Okay.
There have been changes within the last year in the techniques in CPR, so I recommend anyone that has had a CPR class in the past to retake another one and get the new skills. As far as doing CPR, shall we say, as far as CPR being done by an unskilled individual, the damage that can be caused could make the victim that you're working on literally lose their life. Even though literally they're dead, you may have been able to bring them back with proper chest compressions and ventilation. But if you don't know and you're there putting your hands on their chest and pushing, if you're down too far, you can take the xiphoid, which is the little bone at the end of the sternum, and it can slide up and down and lacerate the liver. Thereby the person can hemorrhage to death.
Okay.
If you are up too high, you're not over the heart, with the part of the sternum you should be, so thereby you're not having the heart pump effectively by you being the mechanics of pushing. If you're over to the right or left too far, you can separate the ribs from the sternum. And once they're separated, they could break due to the pressure of you pushing, and thereby become an object that could be put through the heart, through the lungs, and thereby you could cause some pneumothorax, you could cause hemorrhage in the heart muscle, and so on. And with all the damage it's done, the person doesn't have a chance. Right.
So with all that we've talked about, including the CPR and any first aid, that really, if a person is even considering just spending a fair amount of time hiking, camping, backpacking, whatever, it would be best to them and anyone, of course, that they were hiking or camping with, to go and take a course or several courses in first aid and in CPR and whatnot, to really get the basics, so that when they do these things, they're not only helping themselves out, but again, anybody that they're out in the outdoors with. And now the Red Cross offers courses in all of these things, don't they?
Yes, they do. They have several different, shall we say, makeups of a first aid course, and it depends whatever fits the person's time, fits the person's interest. And the reason that it's this way is industry calls on us a lot to teach, so we manufacture courses to fit their work conditions.
Okay.
So for an outdoors person, I recommend personally the Advanced First Aid and Emergency Care course, because it goes into depth and it covers literally everything we've talked about today, besides more serious items that we didn't get into. The courses are charged. There is a nominal fee, but this covers the cost of the materials.
Okay.
And that on the course. All they have to do is call the local Red Cross chapter, which would be the Pittsburgh-Allegheny County chapter,
Okay.
263-3100,
Okay.
and ask for the Health Service Department.
Okay.
And they can help direct them in the way of what course would be best for them and what one to take.
Okay.
Not only is first aid good to know for, shall we say, you to take care of somebody properly, but it's also good to know so that you can take care of yourself properly.
Right.
Even though you may be injured to the point that you cannot literally do your own first aid, you can always direct a bystander on how to take care of you.
Exactly.
And literally save your own life
Okay.
with the skills that you've learned. So I highly recommend a course.
And I do as well, yes. Okay, that about wraps up. One thing that we didn't mention, and as Ken so modestly, I guess, didn't mention when he was talking about some of his background, working with the Red Cross for all these years and whatnot, is you're also a nurse with the county?
With the Allegheny County Health Department, yes.
Okay, so you, besides working with the Red Cross and for the Red Cross, you also do have a great deal of background in the medical field, I mean, as far as this type of thing.
Yes,
so,
I've been a nurse now for over 16 years.
Well, that gives me enough confidence in you. So, okay, that about wraps it up for another week on the Nature Series. I hope that you enjoyed this one. I found it very, very enlightening, and the information was just terrific. Again, if you feel that you're going to be doing any kind of hiking or backpacking, even if you feel that you do know some first aid, a lot of times knowing a little bit of first aid can be more dangerous than knowing no first aid, because you try to do things that you think are right and they may not be right. And as Ken mentioned, even if you took a CPR course a couple of years ago or a few years ago, they have changed the technique, so it would be a good idea to take a refresher course on it and learn the new techniques. So again, if you're interested, give the Red Cross a call. At the end of the program, we'll give you the number again so that you can give them a call. That about wraps it up. Again, we won't be here for the next 3 or 4 weeks. You'll be seeing some reruns. You're welcome to watch those. Again, any comments you have, send them down or give us a call down here at the cable station. So, Ken, I thank you very much for joining us here. It was very, very enjoyable, and I know I learned some things, and I hope they learned a lot out there. So, you take care. I know you have to run to a luncheon here. It's a Red Cross luncheon today, so good luck there, and thank you all for joining us, and we'll see you soon.